To help keep antibiotics working, we have developed an antibiotic checklist for pharmacy staff. This checklist aims to help you optimise and audit your compliance and self-care advice when dispensing antibiotics. It contributes to the national Keep Antibiotics Working and Antibiotic Guardian campaigns. This video will describe how to use the antibiotic checklist. It'll last about 8 minutes. There are 3 stages in the journey of an antibiotic prescription in the pharmacy: the hand-in stage, the dispensing stage, and the hand-out stage. The antibiotic checklist has been developed to support each stage. During hand-in, you will use the green part of the checklist. This is to collect information to check that the antibiotic is appropriate for the patient and their infection, and to help personalise the information for the patient. Ask the customer to tick or circle the relevant answer to the questions. They might need your help. If the customer answers no to "Are the antibiotics for you?", they should continue to fill out the form for the person named on the prescription. We ask, "Are you taking any other medicines?" so that we can check for any interactions between medications. We ask, "Are you allergic to any antibiotics?" because the NICE allergy guidelines recommends that we ask about any reactions in the past, including the symptoms and when they first started. If the patient doesn't know, you should check their summary care record. If the patient has had an antibiotic in the last 3 months, they are more likely to have had an antibiotic-resistant infection requiring a different antibiotic, especially for urinary tract infections. The checklist then asks them to tick which common infections they have. There is a space for them to record another infection. This information is important as it will be used to check that the antibiotic is appropriate against local antibiotic guidance, and also indicates which information leaflet should be shared with the patient on the handout. To make sure we can check that the antibiotic or dose is safe for the patient, we will ask if they are pregnant, breastfeeding, or have problems with their kidneys or liver. The next section gives us the opportunity to increase flu vaccination rates, so helping to reduce the spread of infection and reduce antibiotic use. Many patients are eligible to have a flu vaccine free of charge. If patients have not had their flu vaccine, we could book an appointment there and then, whilst they wait for their antibiotic prescription. The final section on this page allows patients to request information in their own language. We all know that we should be giving lots of advice to patients about how to take their antibiotic, but we rarely have time to do this well. The checklist helps you find out what the patient doesn't know, so that you can give them the most helpful information for them and their antibiotic. We are keen to contact patients by phone or email to see if the personalised information has made any difference. Please encourage them to complete this part. Their details will not be used for any other purpose. Whilst the patient is waiting for their antibiotic prescription, posters, shelf danglers, and desk pads can reinforce the key messages on the checklist. Pharmacy staff may wear the "I'm an Antibiotic Guardian" badge and display the "We are an Antibiotic Guardian Pharmacy" sticker to promote their participation in this campaign. There is lots of material available to reinforce the messages. Please do use as many of the materials as your pharmacy space allows. The antibiotic checklist also supports the pharmacist when dispensing an antibiotic. The checklist points remind the pharmacist to check the risk factors to ensure the antibiotic and dose prescribed are safe. This reminds pharmacists to check that the antibiotic choice and duration follows the local guidance. If you're unsure of the local antibiotic guidance, contact your local medicines optimization team. If the antibiotic does not seem correct, then the pharmacist should speak to the patient to find out if there are any reasons for the prescriber's choice. They may have had treatment failure on a previous course. If you are concerned, do contact the GP surgery for advice. The notes section can be used to record the antibiotic given or additional information obtained from the patient or the prescriber. Based on the reason for the antibiotic and the language or pictorial needs of the patient, the pharmacist can recommend a specific information leaflet to support self-care and prevention advice. The leaflets also contain safety netting advice and signpost patients to appropriate services that they can access out of hours. There are several respiratory, urinary, dental and children's leaflets available, and a number of these are pictorial. We suggest that you make yourself familiar with the leaflets so that you can help the patients to self-care. Some of the information leaflets can be personalised with the patient's name and the antibiotics applied. The likely duration of their infection and safety netting can be highlighted. There are also some important information about taking antibiotics and resistance for the patient and their family. And finally, the Antibiotic Checklist has been developed to support Stage 3, when you are handing out the antibiotics. You can use the patient's personalised information needs list. If the patient has ticked no, you should follow up with the relevant information, sharing the content of the patient leaflet as needed. Staff should use the circular tick points to indicate the relevant information given. The back page can be used to record why the patient didn't or couldn't complete the personalised information requirements. The completed checklist is to be retained by the pharmacy for audit purposes. Pharmacies that use the antibiotic checklist for over 70% of the antibiotics dispensed will be recognised on the Antibiotic Guardian website.